the American Cancer Society estimates that over 19,000 American women will be diagnosed with ovarian cancer this year, and over 13,000 American women will die from ovarian cancer. A woman's risk of getting ovarian cancer is 1 in 78, and ovarian cancer ranks 5th in cancer deaths among women. So today we're going to talk about the 5 things that I think you should know about ovarian cancer. If that sounds good to you, continue watching. Well, welcome back to my YouTube channel. My name is Dr. DuPont. I'm a board-certified gynecologic oncologist, and today I'm going to talk about the 5 things I want you to know about ovarian cancer. So the first thing I want you to know is that ovarian cancer at stages 3 and 4. So typically when we think about the uterus, these would be the ovaries, and the cancer is only in the ovaries at stage 1. But typically if it's stage 1, you don't have any symptoms, so that's why most women present at advanced stages, most commonly stages 3 and 4. The second thing I want you to know about ovarian cancer is that most women will have vague gastrointestinal symptoms. Now, common things being common, a lot of times, if you have bloating or abdominal pain, that's not cancer. But what we're looking for is symptoms that persist, symptoms that don't go away. Women with ovarian cancer will report that they actually do have symptoms. They may feel full faster. I've had patients had heartburn, indigestion, just feel kind of achy in their abdomen, and the symptoms are persistent, and that's the key, that they don't go away. Most normal gastrointestinal symptoms related to like a virus or something you ate, if you ate some food that was bad, those symptoms will go away on their own. But these symptoms that are related to ovarian cancer persist and most of the time progress where they get worse. The third thing that I want you to know is that the incidence is 1 in 78. So if you have a room of 78 women, 1 will get ovarian cancer. So I do want you to know that it is something that I want you to be aware of. It's not as high as breast cancer, but I definitely want you to know that the incidence is 1 in 78. Fourth, I want you to know that ovarian cancer is not picked up on a Pap test. I've had patients over the years say, I just had my woman, I had my Pap smear, everything was fine. How can I have cancer? The Pap test is a screening test for cervical cancer, not for ovarian cancer. Now, I've had over the years, like maybe once or twice, I can count on one hand, where I had a patient that had some abnormal cancer cells that were picked up on the Pap test, but that's not the purpose of the Pap test. That's extremely rare and doesn't happen very often. But I've had patients have, disease in the fallopian tube, that when they were doing their Pap that one day, we were able to collect some cancer cells. And so then that prompted us to do, ultrasound, imaging to see why those abnormal cells are present and where they came from. But remember, the Pap test is not a screening test for ovarian cancer. There actually isn't a screening test for ovarian cancer. For my patients who are high risk for cancer, let's say they have a family history, we'll do frequent pelvic exams. We may do a pelvic ultrasound twice a year, and then often we may do a blood test called the CA-125. Now, none of those tests qualify as a pure screening test, but those are some of the tests that we do in women that are at the highest risk. And usually those are women with the family history, or more commonly women with a gene mutation such as a BRCA1 or BRCA2 mutation. Your doctor has to have a high index of suspicion. So most doctors don't see cancer on a day-to-day basis, and so they may not be thinking about cancer. Again, most things being common, if you come in with some bloating, most likely